बिस्मिल्लाहिर्रहमानिर्रहीम। इय्याका नअबुदु व इय्याका नस्तईन। अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक सल्लिम व सल्लि अला। Dear colleagues, I am Dr. Sultan Ayub, working as a radiologist. And this is a female patient with anomaly scan. So I'm going to scan the fetus. While I am doing the general survey, and then I find this cystic area or cystic lesion that is present just at the level of pelvic region. Here we can appreciate this one. Heart, stomach, brain, so all looks normal. So when I move toward the pelvic region, this is the urinary bladder. Here we can appreciate, and this is the lesion. This is pure cystic lesion, which is well defined. And look at the wall. Relatively, it has thick wall, and this is this lesion is originating from the pelvic area, and it is extending inside the fetus through the pelvic region, and it is covering the pelvic area. This is the urinary bladder, and this is the pelvic area, and this is the abdomen. So it is not extending to the fetal abdomen, but it extends toward the pelvic region. So let's figure out from where this cystic lesion is rising. So this is the spine, and this is the lesion. Look here, this is the spine, this is the lower lumbar region, and this is the sacrum, and this is the coccyx, this one. So this lesion is arising from the sacrum and coccyx. So both the segments are involved. So this lesion, which is arising from the sacrum and coccyx of the fetus, and it is pure cystic, we can't appreciate the solid component. This is most likely the sacrococcygeal teratoma. It is the most common tumor of the fetus and neonate at the sacrococcygeal region, and it contains all germ cells like ectoderm, endoderm, mesoderm. So all layers, uh, germ cell layers are present. So it is basically the germ cell tumor. And what are the differential of this lesion? So it may be meningocele, or anterior meningocele. So let's see if these lesions are present like meningomyelo and meningocele, and there should be defect at that region within the spine. So I'm going to take look at here, up till now there is no defect here, no defect here. So the spine and its posterior surface is normal looking. So these differential which I have told you, the meningocele or anterior meningocele, or there may be the rectocele, all are not in this case because there is no spine defect, no spina bifida is also seen. So this lesion, in my opinion, is, look here, sacrococcygeal teratoma. So there are four types of sacrococcygeal teratoma according to the location. If it is purely outside the fetal body, then it is type 1. And if there is some mostly outside and mild or minimal portion is inside the pelvis, it is type 2. And if it is minimal size is outside and maximum it is pelvic and extended to the abdomen, pelvic, then it is type 3. And if it is pure intrapelvic, then it is type 4. So I have seen this. Look here. This is the pelvic region because this is the urinary bladder and this is the pelvic. So it is limited to the pelvic region. So we can say that it is sacrococcygeal teratoma type 2. And the complication it may cause due to there is a, what we have seen, that there is no solid component. This is a highly vascular tumor if the solid component is present. And due to this high vascularity, it may cause arteriovenous shunting, and then there may be cardiac failure or high output cardiac failure. But I have seen, we can see that normal looking heart, and also no fetal edema is present, no ascites porphyrion is present. This tumor may complicate to these uh, things, as I have told you, the cardiac failure, adult fetalis, pleural effusion, ascites, but all these pathologies are not present, all these findings are present. So only this pure cystic lesion is present, which is arising from the, look here, this is the sacrum and here is the coccyx. So it is arising from the sacrococcygeal region and it is pure cystic with well-defined wall and it is extending. This is the extension into the pelvic region. So it is a type 2 sacrococcygeal teratoma. Okay. Look here. Due to pure cystic lesion, no vascularity is seen here. So this was all about the sacrococcygeal teratoma. Thank you very much.